Welcome to In All Honesty, the podcast where we get real about life and all the problems that come with it. I'm Michelle Elman, and I'm that friend who we all know is a little bit too honest. You might not come to me when you get back together with your ex, but I'll be there for you when it all goes tits up. Welcome back to In All Honesty, and today's co-host is one of my favorite women in the world, Dr Nighat, who I met via This Morning, and I only know because of This Morning. No, that's not true.
That's not how we met. She's lying. That is actually not how we met. I stalked her because she was going to be talking at the International Women's Day Hello Magazine event breakfast, and I saw her name, and I had picked up a book that said how you can be absolutely selfish. And I actually read that because one of my biggest issues is I felt that I wasn't selfish enough. I'm a giver. I'm the eldest of 5. And suddenly there was this voice that was saying, actually, it's all right to be selfish. And I'm a mother to 3 boys. So when I saw her name on the billing and I was invited by Rosie Nixon at Hello, and she was like, come, it'd be really great. And by the way, Michelle is going to be there. And I was like, oh, no way. I read her book. I'm coming.
My talk that day was Be a Difficult Woman. Yeah. I had not planned that talk. I knew I was giving a talk, and I remember someone came up to me first moment in that event and was like, you know, you're giving a talk, right? And I was like, oh yeah, I've not prepared anything. And they freaked out.
She smashed
it
though.
I'm going to be fine. And then got on stage, and the first thing that came out of my mouth was Be a Difficult Woman. And I just went with it. But
that's not how I knew you.
The point is that you are a giver, because I was trying to do your glowing introduction, and somehow it became a glowing introduction of myself. They know me. They don't need an introduction to me. But Dr. Nighat is an amazing author, an amazing broadcaster. Her segments on This Morning, largely on health, are so informative, so eloquent. And yes, I was wowed by you the moment we met. Not only because of how smart you are, but also because you are a champion of women. Dr. Nagat is one of those people who, when she rises, she turns around and puts her hand back to help the person below her.
That's so kind.
And I think that is such a beautiful, wonderful trait. And genuinely, one of my favorite parts about this podcast is I get to have people like you on, because I actually just want to thank you for being beacon of light in this industry and wanting to broaden the stage for people who are more marginalised and don't have as many opportunities as you. And it is genuinely the trait in you that I respect the most, alongside all your brilliance.
Oh, that is so kind. That is so but I have to say that comes from a lived in experience of being that marginalised individual. And also, you know, I am grateful that there were other people who were pulling out chairs at tables for me or opening up doors for me. And sometimes just by serendipity, a door opened. And I totally believe that it gets really lonely if you close that door behind you or if you don't pull out a chair for another person. And I think that for me, diversity is the flavour of life, and that is how we progress and we learn from each other and we break down so many misconceptions about each other. So the only way to make sure that your table or your plate is full of the right combination of, you know, flavours and colours is to have all the right mixes of people right there.
You know what I've realised recently is that actually with so much around beauty ideal, especially, we've actually been striving so much for sameness that actually it's interesting when you look at it from the point of view of like diversity, inclusivity and feminine health, of like, even when it comes to like our hygiene and our sexuality and things like that, we all assume we must be the same. And actually, where did that even begin? Because we are designed different, we are designed unique, and we seem to just keep aspiring for this norm that doesn't exist, whether it's beauty, whether it's feminine health, whether it's literally the media that we see.
I will say that it comes from one single question, and I see it in my consultations, and I see it as part of life, and it extends, I think, most of what we do throughout our being, from the moment we're born to the moment we die, is this normal?
Yes.
Am I normal? I would say every patient, if they've got like a lump or a bump, or they've got discharge from their vagina, or are they not climaxing that they want to do when they're having sex, their first question is this normal? And I think it's because we then, our reference points are then narrowed to a Western ideal, whether we like it or not, because that's exactly how medical textbooks have been framed, and that's where data and research has been framed around as well. Because if we look at still marginalised communities, Black, Asian, Chinese, faith groups, if we look at, you know, those from have a visual impairment or hearing impairment, they're not always included in mainstream research. So they don't know what normal is, but they strive to look for normal. And as medics, we're constantly looking for, is this normal? Do I need to worry? Does this need a referral onwards? And does it need checked out? Then the next thing, I think the reason that we don't have an idea of whether this is normal or not is because we do still have a spectrum of a narrowed view of society. And we very much are looking for labels. We give everybody a label constantly. I'm the hijab Muslim woman. That's the label that I get constantly. And I'm different.
Yeah, I'm plus size, scarred, Chinese, mixed race.
Exactly.
woman.
To me, all of that is like beautiful, 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 like tick, tick, tick. And I think that the thing is that when society tells you that that isn't beautiful, so you then start then thinking, am I different because I don't fit the norm? And so you want to strive for that.
I never saw myself as those bunch of labels until I became a public figure online. Yeah. And then I got labeled as those things. And then it became your branding, your identity, how agents pitch you out, things like that. And then it's funny because you do internalize it. Whereas like as a kid, did I ever think I was this bunch? It's why I'm so resistant to labels now. And actually it's probably one of the main reasons I decided to not become a psychologist and become a life coach, because within psychology, you work within diagnoses so much. And I even found resisting, it was largely moving here when I was 11 that I started noticing these labels. And I hate all of them because it's assuming each label is a monolith. Like assuming Chinese means something about me, scarred means something about me, plus size means something about me. But actually there is so much diversity within one subsection. And when you're closer to the beauty ideal, or you're more Eurocentric, you're more white, you get that nuance, you get that complexity. Whereas if you are in a marginalized group, it's so narrow that it almost feels like you have to behave in that certain way to be accepted.
Society is set up to be squares. And when you don't fit that square, or people like to put you into a box and then put a label across it, that's it, you're dealt with.
Yeah.
So you would never see yourself as that. So society then online, when you became a public figure, as you say, that's when you realized, oh gosh, I'm this and this and this.
Yeah.
Then conversely, that can also be a kick in the face at the same time, because then you're just thinking, the thing that we always get with the marginalized complexity is that, are you then the trophy individual, or are you then just a tick box exercise for someone to say that you were represented?
Yeah.
And I think that is always the conundrum that we have. Because I would say I never see myself as just as the hijab Pakistani doctor, or a woman of color. I would say this is just something that is representative of me, and I bring my whole as a whole self to everything. But when society looks at me on telly and they're like, oh, that's the woman with the head covering.
Yeah.
And they build their own connotation of what Muslim means to them.
Yeah.
And that, unfortunately, could either be a good thing or a bad thing. And I suppose my challenge is always, am I there because of how good I am, or because I tick someone's box? And I think that tokenism is the conversation as a society that we constantly need to have with ourselves and also individuals. So for you, being where you are at the moment, actually the reason you never saw yourself as that, because you never saw yourself as a token.
Yeah. I also think because when it came to my labels and my specific identities, I never got brought up that way. So I grew up in a very multicultural household. Exactly. My mum is not stereotypically very Chinese. My dad is not very stereotypically Jewish. But even like when it comes to my surgeries, my brother's like less than a year older than me, and we never got treated differently just because I'd had 15 surgeries. So I think it's also how you're raised, and so then it became a bit of a culture shock. But I also find that all of these marginalizations do have a place in the doctor's office, where if you come from a people of color background that's a weird way of saying it, sorry.
A person of color, yeah.
if you are a person of color, usually you have to advocate for yourself more. Usually you're not listened to as much. And specifically when it comes to women, there's an assumed higher pain tolerance.
Yeah.
Is that right?
Yeah. So we have data to back this up. So there's lots of studies that you can look at. That actually the BBC did a really good study where they looked at. So let's just look at pain in women. So women who go to A&E, say for endometriosis pain, are less likely to believe. They're more likely to be told it's in their head. and they are less likely to be given pain relief compared to a man that goes in, and they're more likely to be given stronger pain relief or go up the pain relief ladder a lot quicker. And there is this assumption that women can tolerate pain better. So there is this myth that's been hanging around. And if you look at where that comes from, actually, it comes from institutionalized racism. So if you look at gynecological pain, so women are expected to have pain. They go through periods every month.
Yeah.
So why aren't you putting up with this pain? Why aren't you now, your body is used to this. We also have childbirth as well. So we give birth. That's also part of being, getting pain as well. But if you look at where that entrenches, so Sims, which is one of the gynecologists, and they say is a godfather of gynecology, experimented without anesthesia on black women constantly using instruments. So the speculum used to be known as the Sims speculum. So everything that we use in gynecology, even from the instruments, was all trialed first on black women because it was thought that black women didn't feel pain or their nerve endings weren't affected as much as white women. And we don't even have to go that far in history.
So sad.
It is so sad. We don't even have to go that far back in history. So in 2022, yet again, there was a paper that came out that said the woman's cervix, so at the neck of the womb, doesn't have pain fibers on it. And I read that and I just thought, I'm not going to swear, but I was so annoyed at that because there is this still assumption that certain bits of the woman's female anatomy, because it expands and it contracts, that actually there are no nerve endings. And these are sometimes respected papers that will print stupid things like this to perpetuate that effect that actually women don't need pain relief for hysteroscopies. Women don't need pain relief for, say, a Mirena coil insertion.
I was just about to say that.
Yeah.
That's the one that everyone keeps saying, like, if it was a procedure that a man had to do, there would be no question you'd be given some sort of anesthesia or some sort of numbing agent, but women are expected to do this pain-free, without pain.
And the thing I say constantly is if a man bled out of his penis from the age of 12 for 10 days every month up until he was about 52, I'm sorry, but we would have so much more provisions done if that happened to men. But the fact that women do this on a monthly basis, on average, I know that if you've got other conditions, you might not bleed on a monthly basis, or you might bleed more in a month, but we still don't have the data and the research is absolutely atrocious and shocking, but that's where we are.
Isn't there also some shocking research about how there is more money and funding that goes into the male pleasure around sex than there is around actual problems within women's health? Like around erectile dysfunction, for example, than something like thrush or UTIs or things that a lot of women suffer from.
Yeah, there is some crazy figure that only 1% to 2% of GDP of a country is ever spent on women's health, which actually 52% of the population is affected by that. But I constantly come back to this, and I think that the conversation, we now need to move on in 2025, not to say, okay, men have this and women have this, because men's health is just as bad. Let me put it that way. You look at erectile dysfunction, you look at prostate cancer, you look at low testosterone in men, you look at testicular lumps and bumps, or, male eating disorders. I would say, male mental health, it's still shockingly bad for men. But we do know all the statistics now. We have all the data that's there, but we're still admiring the problem.
Yeah.
That's the worry that I have. We're sitting there going, the data and the research and the funding that goes into women's health is shockingly poor. Can we stop admiring the problem now? Can we actually do something about it? Because we know exactly what to do about it. You've talked about it constantly when it comes to mental health and what women need and advocating for themselves. But the doing bit doesn't seem to happen.
So what is the practical next step? The increase in money?
Actually, no. The data doesn't show that sometimes we need money all the time. So let's look at women's health in its entirety. Women are doers and they know how to look after themselves. You know how to look after your scars really well. Let's pick up that for that example. And you know when your scars are causing you a problem internally, and you know this is when I need to go and get help. What actually the data shows consistently is that when a woman is talking, that we actually listen to her and not refer to either a male member that she needs to come talk about the issues that it happens. There's a really funny anecdotal story where a Formula One engineer who fixes Formula One cars is female. she took her car to the garage, and the chap at the garage kept talking to her husband, although he knew nothing about cars. And I see this consistently in consulting rooms, that when a woman is having a consultation about a hysterectomy, so having her womb taken out, the healthcare professional will constantly talk to the husband. Are you sure this is what we... And she's like, I am the person who's having the surgery. So I think the number one thing is listen to women and believe women.
You know, I've had a number of issues being listened to by doctors, and considering how much experience I have being in a doctor's office, I really should be listened to more. But I once actually got told, as a piece of advice from one of my neurosurgeons, who is a man, next time bring a man with you and they'll listen. So I started bringing my dad over with my mum.
Isn't that awful?
So bad that actually he knew that was a part of the problem. And it actually happened when I was, 24. The last time I was in an A&E, I had obstructed bowels. I walked in and was like, I have obstructed bowels. I've had it 3 times. This is obstructed bowels. And literally no one would listen to me. I was there for 7 hours and everyone was like, it could just be a stomach ache. I was like, I've had 15 surgeries. I've had a brain tumor. Like, my pain tolerance is not low. And it was just... It's kind of dehumanizing having to say that, though. And the truth is, when I get given a 1 to 10 pain scale, I just think my 10 is so off the scale. I have only ever used a 10 when I literally had my intestines leaking inside my stomach. So I'm usually giving about a 7 when other people would be giving a 10. And it just got to a point where I realized, well, no, now I have to start saying 10 because otherwise they're not going to listen to me. And it's not true for me because, like, I've been through worse, but I shouldn't have had to be through. Yeah. And it was, I just remember that moment of, like, I've had it 3 times. And I remember sitting there being so frustrated because this nurse I was talking to, or the doctor I was talking to, probably had never experienced obstructed bowels. So the fact that I'm like, I know my body, I know this sensation, and I've had it twice before and was right twice before, and I can say with certainty I have obstructed bowels right now. And yet because this is a sentence that I say a lot and I teach people when advocating for their body, and it really pisses doctors off, but you are the expert in your own body. You are the only person who is in your body. And without them having that information, which is why you have to get better at communicating it, they cannot help you. But even with my level of advocacy and even with my knowledge and being able to say, this is obstructed bowels, I know what it feels like. You don't, by the way, because you've never had it. Please listen to me. It took 7 hours for them to listen to me.
And isn't it so simple just to do that? So you said a couple of things there, which was advocacy. You said, listen to me. I want to be seen and heard, but also believed. And I think that the last thing is that the person living that chronic disease or chronic condition is the expert far more than anybody. That doesn't take a lot of money to sort of do the simple basics. So I would say when it comes to stopping admiring the problem and actually doing stuff, so that's number one, is like do the basics, which is just believe women and understand that they're the expert. The second thing is empower marginalised communities to communicate health education in a way that works for them. So when we did breast cancer checks in a Somalian community, actually going out and teaching them this is how you do it didn't work because we needed the men to understand that they have to tell their partners or encourage their partners to go for mammogram screening. And we've got to understand that it's not men against women. They need to work in a partnership, especially in that particular community. And it took a woman from that community to go to us, Dr. Nighat, why don't we do making bread dough balls? Because bread is so common. Men and women in the community know exactly what to do with it. They'll make it. We'll put a pea in there and get them to examine it. So we did a workshop led by the community in the language that they understand. They made bread dough balls. And the men said, oh, this is what we're like trying to look for in the woman. And we're like, yeah, if you feel a lump, you need to go for your screening or make sure you go to an appointment. Wow. And this is why we are encouraging women. And actually that meant that the women were like, okay, so that means that we can catch cancer early. In some communities, song and dance might work a lot better because the written form doesn't work so well. They still do it by speaking language. I mean, the fact that when it comes to British Sign Language, we don't have a word for menopause in the British Sign, it's men and stop. And so working with the sort of the deaf community is so important.
You make me speechless.
Language, exactly.
What?
Exactly. It's crazy. And so that doesn't take a lot of money.
Yeah.
You need to empower communities to uplift their own, which is where we started right at the beginning, opening doors.
Yeah.
And we need to tell the communities that what they're doing is backed up by science. And we're doing that already. There's a lot
Yeah.
of work that myself and Professor Dame Leslie are doing when it comes to the Health Collective with the charity Wellbeing of Women. And then finally, the last bit, I think that does need a bit of money and research behind that. And that is more collaborative. And I think it's a global conversation now. That is when we need to start actually data researching into the nuances of different communities. So that means breaking down the barriers where communities are so scared to come forward and be researched.
Yeah.
Because historically, if you look at pharmaceutical companies, ethics have not been their forepart. And so horrific things have happened. So if you look at the HIV drug trials, if you look at meningitis vaccines in the Nigerian community, the trust has been lost massively. So what we need to do is recruit some of that trust. The fear that I always have is now in the mix of all of that, we've got misinformation, disinformation on social media. We've got individuals who thrive off chaos. Mr. Elon Musk, shall we talk about him for a bit? And how he keeps telling us that the pill is the worst invention in the world and it makes women fat. And I'm like, mate, Elon Musk, let me tell you, an unwanted pregnancy will make a woman fat if that's where you're going to go with us. And if you can now bring out a male contraceptive to prevent an unwanted pregnancy, that would be so, so useful.
That's one of my favorite studies, is the fact that when they were exploring the male contraceptive pill, that all of the men dropped out of the study because of headaches, weight gain, depressive episodes, mood swings. You mean all the things that women go through?
Currently with current. So the microgynon, let me just quickly tell you the story of the pill, because I love this story because it's so horrific, but also so good. The pill is the number one liberator of women. I believe that as a clinician, because it allowed women to have their own control on their fertility, and they weren't then being blackmailed and being kept at home and not able to progress in their career. And I think for a lot of women, it actually saved them from having a lifetime of other chronic conditions which will impact them. So it does manage the symptoms for some, for endometriosis. I know it's not a cure, so please don't say that that's what Dr. Nighat is saying. But it manages the pain, it manages the bleeding, it helps manage things like adenomyosis, helps manage symptoms of, say, PCOS or heavy bleeding. So, and even say PMDD, premenstrual dysphoric disorder, where women literally feel suicidal just before they have their bleed.
Yeah.
So if we find the right pill, it means that we can switch off the periods and their PMDD symptoms, means it gives them some respite and they can look after themselves and progress in their career. So the pill has so many benefits. Yes, it has side effects.
I will also say when I was younger, I remember the first time I got offered a pill was a pill without a period, where you don't don't have a bleed.
Yes.
Or is it called a fake bleed? But
so you can, in the combined oral contraceptive pill, there are some dummy pills that you can have in there. So 7 days, you take it for a month, and then you have 7 dummy pills, and that's seen as a break. Or you can take the combined oral contraceptive pill back to back and then have like a 4-day break. Or there's a progesterone only pill, which you take continuously and you never have a break of that. And that
so it was progesterone only pill. And I just found it kind of like messed with my sense of the world, that I think because I was so young, I was like, oh, but then I won't be a woman. Like, I didn't differentiate between a fake bleed and a real bleed. I was just like, no, but I still need the bleed. Yeah. Otherwise I'm not going to be a woman. Like, is that, I don't know why.
And that comes from the original trials. So the original trials, when they looked at that, so it's an American trial where they looked at, say, microgynon, which is a pill that's still around. Just to put into context, we've got now the iPhone 16. We still have microgynon from the 1960s. Long live microgynon. And that pill is estrogen and progesterone, synthetic hormones, which was the idea was it stop the egg from implanting, and it changes the cervical secretions around the cervix, so it's a hostile environment for the sperm. But in that original trial, which was only like 2,000 women that they managed to have, they had to make sure that they were married women, because there's moral and ethic, there's morality that comes into just having the pill. We'll talk, that's a whole other different conversation when it comes to morality and contraception. Then out of that trial, 4 women died.
Wait, so pausing on that. So the morality thing is they didn't want to give it to single women because it encourages promiscuity.
Yeah. How dare they? How dare women have pleasure?
Casual sex, yeah.
Casual sex. Because that was what they were. And also the Catholic Church was very much involved in sort of the ethics and the trials at the time. And so they didn't want women to be sleeping around because, you can't have sex outside marriage.
Honestly, do you see why I'm so in awe of this woman? And the first time we met, I remember you saying, periods aren't meant to be painful. And
Yes.
even that blew my mind. And
Yeah.
I was like, what? But we always, I mean, in my school, we called it the curse.
Yeah.
Like
And
that was the
it's
we never
still
said the word
something-
period.
So I look after a lot of Gen Alpha. I love my Gen Alpha patients. They come in, everything's skibbity riz. Like, that's amazing. And so that's all my Gen Alpha ones that are listening. But they still have that perpetuate, because if that's in the household and that's the norm, that periods are really painful, mum takes a hot water bottle and we don't see her for 3 days when she's bleeding, even though they might not know that she's bleeding, or we don't even use words like periods, it's that time of the month, and we use other pseudonyms, then actually that just is the norm and you never question it.
One of the things I changed in dating, probably about 5 years ago, is I don't shy away. With men that I'm sleeping with, dating, whatever, in relationships with, I will say I will not use pseudonym. I will not use a pseudonym. I will literally say period, and I will say words like vagina and vulva, and I will use the actual word. And you know what? If a man gets scared off by that, it's a really good detector of like, yeah, you're not my man.
Yeah, exactly. But also there's some real data behind the fact that if you use anatomically right words, the rate of child abuse decreases. So if children are taught this from a young age to say vulva, vagina, labia, this is my clitoris, and then actually they can communicate that with an adult and say, look, if God forbid it never happens and you don't come across it, but if they're being inappropriately touched by somebody, they will use the right, and it's much faster than using flowery words in that area. And we think we're doing children a benefit. We're not doing them a benefit at all.
And do you think it's important we learn the difference between vulva and vagina and actually start using the word vulva more?
Absolutely, we need to use the word vulva. So the vulva is the outside, what you see, the anatomical area. And then you have the labia majora, which is the outside lips, labia minora, which is the inside lips, and then the vagina literally is the hole. And we have 3 holes. We have the ureter, where we pee from, then we have the vaginal hole, and then we have the back passage, which is the anal.
Sorry, can I tell you something really embarrassing? I can't believe I'm going to say this on camera, but I'm going to say it.
Go on.
The first time I tried to insert a tampon, I had 3 friends outside of the bathroom stall, and I was screaming in pain because I was trying to put it up the wrong hole. And I didn't know. And you know what? It's been a consistent thing throughout my entire life of I just didn't have adequate enough information. For example, I discovered when I was 20 years old that you were meant to pee after sex by getting the most excruciating UTI. And then I went to the doctor and they were like, well, did you pee after sex? And I was like, no one taught me that.
Do you know what? Firstly, the tampon story, you're not alone. And I'm really glad you shared it, because there'll be lots of people who will be like, I was exactly the same. And I think tampons do get this air of real fear. And I was 37 when I started using tampons. And
I still don't love them.
Yeah, but it's like I look back and I was like, God, but it gives me so much freedom now that I do use them.
Well, for swimming, because we both love swimming.
Exactly, for swimming, and I don't need to take a break and etc. But the other thing is that not knowing those anatomical areas means that there's a lot of harm done to it, and then we perpetuate that as doctors by making the woman think it's her fault. Why didn't you go for a wee after having sex? Firstly, I think that comes from the fact that we are still judging and placing morality on women having sex for pleasure, and also especially if she's not in a committed married relationship. I do think that is still the case. And I think even women who are married, if they're having sex, it's like, you should be having sex for reproduction only. Why are you still having sex? And so after sex, go and wee. But that comes from the fact that we're not educating women about their vulval flora. The vulval flora is this amazing hybrid, I would say metropolis of the good bacteria and the bad bacteria that we need. And it's because our perineal tissue is very close. So that's the gap between the posterior fourchette, which is the bottom bit of the vagina, and our back passage. Now, in our back passage, we have lots of good bacteria and bad bacteria. And so we sort of make the assumption that it's because they're not clean, so you need to go and wash yourself. Yeah. Actually, what we need to be saying is really encouraging the idea about lubes and making, even though...
Friction. And friction is a big cause of that.
Exactly. And also saying to women, I've got nothing against it, but I think using that as the sole reason of UTIs, for me, really concerns me, because we're not also thinking about the lowering of estrogen, which comes in combination of depending where you are when you're having sex. you don't time your sex. Whenever the moment comes, I say take it. But if you are in that 10 days or before your period, your estrogen decreases. So the estrogen, as it decreases around the vagina and the vulval area, means that actually there is a little bit of disruption in the ability of your body to fight off infection. Yeah, so it's more dry. Women experience that. The tampon starts sticking. We see it more and more when women are sort of in their perimenopausal years, which can start at 38. So that means that your rate of UTI increases. What we need to be encouraging women is saying, look, if you're having sex, please always use a vaginal moisturizer. The moisturizers you should be using in your 20s. And even I'm now encouraging 14, 15-year-olds to start thinking about moisturizers.
I think one of the conversations that I've always got really frustrated around in feminine health was the thrush UTI thing. That once you get in that cycle of either having repeated thrush and Caniston's not working anymore, or you get thrush, you get a UTI, you're trying to fix it, you take antibiotics, you end up getting thrush. And it's this cycle. And what I always thought, because I know about the lack of funding, I always thought, why isn't there a better solution around this? Because how is the only solution to a UTI something that causes another issue? And also then there was a period of my life where I had like consistent thrush that I couldn't get rid of. And the only solution was take more Caniston. And I was like, why is there not another option?
There are other options. So the first thing with thrush is that the symptoms, which is the most common one, which is an itch, we always assume is going to be thrush, and it's not always entirely thrush. It could be other skin conditions like vulval lichen simplex or vulval lichen sclerosis or vulval lichen planus. Now, these are 3 different skin conditions, but if you look at vulval lichen simplex, it's a bit like getting eczema, but you get eczema there and you get that dryness. And as the skin gets more dry, it produces histamine, so it makes you feel like you want to itch, and it could be that you're itching at nighttime. It's not thrush. The other symptom that we have with thrush is you get this cottage cheese-like discharge as well, and that is thrush, and that's why we need Caniston. Now, the thing that causes thrush, the underlying organism, is yeast. We are born with yeast. We will die with yeast. We have yeast everywhere. I should put that on a T-shirt somewhere. Yeah. I really should. And so we have yeast all the time. Yeast is so dependent on what our immune system is doing. So decreasing in estrogen means that our immune system is going, but I need estrogen because the immune system in that area uses estrogen as an immune modulator. Yeah. That means it uses it to work and function. So number one, that replacing estrogen is important. And I think we need to start having this national conversation as healthcare professionals about giving younger women who get recurrent thrush and thinking about estrogen, topical vaginal estrogen, low dose, very safe, doesn't absorb into the bloodstream, doesn't increase your risk of breast cancer. Secondly, gut health. It's so important for yeast. So if you're insulin resistant, if your sugars are high, if you are not looking after your gut because of stress, remember 1/3 of your immune system sits in your gut. 80% of your serotonin, your happy hormone, is in your gut. So if your mind and your mental health isn't great, that's also going to impact the vulval vaginal area as well. And then finally, the other reason why we do get a flourishment is if your body's too busy doing something else. So we see individuals who have, say, other conditions where the immune system is so busy. So celiac run down, stress, high levels of cortisol, or you could have inflammatory bowel disease, IBD, or Crohn's. That's also going to mean that your immune system is so busy. So autoimmune conditions. This is why I really do believe that autoimmune conditions are inflammatory conditions where your immune system attacks itself. You have to look at that. So thrush can't be bung some Caniston on it, get some antibiotics and tell her to piss off. That is essentially what we try and do a lot. But we never take the holistic approach even for thrush. And that's because nobody thinks about the body as a whole and the fact that we are literally this perfect hybrid of our hormones as women. And it was only in 1993 that they started thinking about women as hormonal beings.
That's when I was born.
Exactly. Oh my God. Such a baby. I feel so old.
Don't. But no, it's funnily enough, when you said holistic, the thing that was my solution, because it always started with UTIs, was, I'm going to forget the name of it now, but I got told to take this supplement. And if I can take it before I get UTIs, it actually...
Cystopirinol? So it's a sachets that you would have and they taste not so great.
No, it's...
Or D-Manos is another one.
D-Manos, that's it. Yep. So I found it on Google. I was searching because I was so desperate. I went to so many doctor's appointments and no one could help me. So I started taking D-Manos and it genuinely... I don't think I've had an issue in 5 years. But
D-Manor.
why is this not being suggested as like a preventative? Because like I understand it's not going to do the same as antibiotics once you've got it, but actually it has prevented me from getting it since.
Because we never think about the hybrid of the vaginal flora. I come back to that. Like not many people know about the vaginal flora. We don't teach it at schools in the way I think we should. And then healthcare professionals are just taught disease and treatment. Or not even a cure, disease and treatment. And also because it's something that's so common, is just as a throwaway, a thrush is so common, women know how to deal with it, here's some Canesten and she'll be fine. Never thinking of the fact that actually, again, D-Manor is
again,
trying
if
to...
this was men and this was preventing men from having sex and preventing men from pleasure, and like, I understand you don't like comparing it to men, but I do think it would be prioritized more. There would be more options. And even when I was having these conversations in gynecologist's office, so many of the people I was talking to were like, unusual discharge. And it's just like, even saying the word discharge is seen as like because
dirty.
people are embarrassed. And I don't think there's enough conversation about how different women's discharge could be.
It's so, like my book, The Knowledge, I literally have got different colors of discharge, and that is the one page that even my sister, who is very hard to impress, she's a dentist, she was fascinated by that because
your whole book is impressive, by the way. Like the whole book also is so inclusive. Like to see a medical book with different bodies represented is just and it's not by accident.
No, I did that on purpose.
It's very intentional.
And stretch marks, I was like, I want my models to have stretch marks on them. I want like what skin conditions look like on black skin, because I never have that as a medical student. I had Muslim women with different hijabs in it. But also we need to know what different period blood looks like. We need to know what different discharge looks like. For some reason, and I don't know whether that's the porn industry. I know that we'll probably end up going down this road at some point, so I might as well mention it. But the porn industry have a lot to answer for about what we think about when it comes to female pleasure and the women's vulvas and vaginas, because there's this idea
and men's understanding
understanding, there's this idea that she should only be wet for a certain activity, but actually women are constantly producing discharge. Like you have to, it
but
protects
also,
you
I don't
from so
love the
many
association of
so
wetness.
we shouldn't be dry, we should never be dry at all.
But also the association of like wetness equals turned on. And so if someone is more dry, they're not interested in you. Like all of that. And then as a result, there's some sort of shame around using lube to have a more pleasurable experience, when actually like some women's bodies are different.
Yeah. I mean, that is the biggest argument for abuse. She was wet. Because that was part, and it's seen as part of consent, right? And that's awful, because actually
so it's both sides of the coin as well.
I would say I now sort of use survivors and thrivers of abuse. I never say victims now either, because I think that minimizes and also puts them in a lesser role in the fact that they're trying to deal with sort of some horrific trauma. But as a clinician who used to work with patients who were affected by sort of, sometimes traumatic sexual encounters, or women who've had episiotomies, or they've had vaginal tears after birth, because remember that's the other time when our vulval vaginal area actually, I say mashed, which isn't the right medical term, but that is actually the time when we get real trauma down there, and it impacts the way our vaginal flora works. But there is this assumption that we have that if the woman is wet, then that means that that's consent to do that, she was ready for it. And I think that conversation still needs to happen, because that doesn't equate consent at all. Consent is still yes or no, verbally, and it's not coercive. And that is something that is constantly that we need to teach about, and also tell women that it's not your fault that you were wet, because you are genetically programmed, and that's your biology doing its job, because it's protecting you against infections.
Wow, honestly, there are very few people in this world who can make me completely speechless, and you just are one of them. And like from the moment we met, and like so often we're chatting as friends, I forget that you have this side of you. I don't forget it. Obviously, I remember
she
it.
She forgets all the time. She's like, oh my God, she's actually
no,
quite intelligent.
It's just, as you were talking, it genuinely gave me a flashback of the first time I met you, and just like when you said periods are painful, and I just like glazed over and was like, what? Like, it's such a simple sentence. And
it is.
So if there's anyone listening who's having either like persistent thrush or UTIs or endometriosis or any of these things, how do you recommend advocating in a doctor's office? Like, my simplest advice I tend to give is be specific, use the words, be as detailed as you can, and say more. You never know what piece of information you're missing out. Like, write it down if you have to, so you don't forget, and hand it over to them if you can't vocalize
I've even
it.
got to the point where I've said to patients, if you want to take a photo of your discharge, mate, do it. Like, I want to see the color of it. If you want to take a picture of the clot that's on your panty liner, I want to see it. I have actually in my career as a doctor had people bring in specimens of their said tampon, pop it down on my table whilst I'm trying to eat lunch. So
If it makes you feel better.
I have nothing against that, but I have to say that has happened to me a number of times. Or they will come in with, I once used to have a patient who would always bring in her poo to me, bless her.
Well, so this is what I was saying.
She
when
would
you have
bring it
obstructive
in
bowels,
a freezer bag.
Oh, what?
Yeah.
Okay, no, not this.
And then she would bring it in a freezer. I don't know how she got it into a freezer bag. I think she must have scooped it out somehow. And then it'll be like pellet-like, and she'll bring it out in this flimsy freezer bag, and she'll pop it on my table, and she goes, "This is the why poo is like." I'm like, "Thank you so much," but I actually don't like.
Need
just
that.
take a photograph of it.
So when you have obstructive bowels, the longest time I was in hospital was 6 weeks. They come into your hospital room asking, "Have you pooed yet?" every single morning.
Yeah, they do. Yeah.
And so the day I finally pooed, not only did my doctors get a picture of it, but all my friends got a picture of it. It was like a toddler had done their first poo in a potty, and I was like, "I pooed!" Like,
Wow.
It was the weirdest thing I've ever done. But after 6 weeks of just like praying for that poo to come, you're like,
it's like having a little orgasm or a baby.
But I
It's
remember
so
I
nice.
told one of my friends like 2 weeks ago, like, oh yeah, I was telling him the story, and he was like, "Wait, you literally didn't go to the toilet for 6?" I was like, "Yeah, that's what an obstructive bowel is."
Yeah.
And it's so funny because when you use medical language to like talk around it, it sometimes just needs that extra like, no, what it literally meant was I didn't poo for 6 weeks. So of course I was stuck in a hospital bed. Like that helps people. Or even the experiences I've had of like telling people I've had surgeries, having 15 surgeries, and then I'm taking my top off for the first time and they're shocked by my scars because they don't compute surgery to surgery scar.
Yeah.
Like I think when you've grown up in hospitals, you're so used to the language. I remember it blew my mind when I was like 21, one of my friends not knowing the word for stethoscope. And I was like, what? I knew that at like 4. So
that's like your scope is very different.
it's very different.
Coming back to thrush and that sentence that I love to say, I've got a few key tips that I think is so important because it is something that comes up so common in my surgery. So number one is never assume it's just thrush. So always get a swab if you've had it recurrently just to check. And if it comes back to show that it's not yeast,
do you go to your
then it's
GP
not
for that?
thrush. You can go to your GP or you can go to any high street pharmacies. You can now do self swabs as well.
And sexual health clinic, right?
And sexual health clinics. So there's a number of places that you can go for free. And sometimes the sexual health clinics will send you a kit at home and then you can get it back. It depends on what postcode lottery that you might have in your area. So it's well worth researching. Secondly, see if the episodes of thrush ever land in and around your periods. Is it a week to 10 days before? Because that's when your estrogen is decreasing. That's important because then you can advocate for yourself to go, maybe I need low dose topical vaginal estrogen. And there is no age limit to that at all. I'm really trying to get the message out with my colleagues to say there is no age limit. And so it's not just reserved for older women. And the reason I say that's important is because for some, we don't have the full data yet. It could actually make their symptoms a lot better because you're feeding the immune system back the estrogen that it needs. And it's low dose, 10 micrograms twice weekly. And maybe you just need to give a bit at that time. The other thing is look at your gut health. So really think about what else you're doing. Is it too much sugar in your diet, refined sugars, processed foods?
As well.
Yeah, probiotics. So kefir would be really good. This is where D-mannose really might come into play as well. So looking at what things that you could do to balance out that good to bad bacteria as well, because we know it's not just the area of thrush in your vagina that's affecting you. It could be that it's higher up that we need to treat. Finally, rule out other conditions. There are some conditions will impact the immune system. So if you're diabetic, that will also impact your immune system. So recurrent thrush might play a role in there, underactive thyroid and anemia as well. So get your hemoglobin checked. And also if you're doing that, make sure you get your ferritin checked. And if a ferritin is below 70, then I would say you need to consider taking iron supplementation 3 times a week just to help top up your iron. But those are the sort of simple things. And then obviously use Canesten if needed, if it definitely is that. But finally is get a doctor who's able to look at your skin to rule out other things like eczema around the vulval vaginal area, which will also give you similar symptoms, or vulval lichen sclerosis or vulval lichen planus.
You mentioned vaginal moisturizers. Are there any like brand names you recommend?
Absolutely. I was coming on to that because vaginal moisturizers are really interesting because there's so many now on the market. And again, any age, I would say start looking at them. We moisturize our face because we want that plumpness, that hyaluronic acid to give that sort of texture back into the skin. We need to do that around the vulva and the vagina. And so the ones I would go for are ones that don't have glycerin in them, because glycerin is like a type of preservative in sugar that can feed the sugar. And you don't need to do that because that's going to feed the thrush. So not that I'm affiliated with this brand or paid by them, but I would recommend the brand Yes Organics. Buy that from any high street pharmacy or online. And you can get Sutil as well, which is another brand. And you can get that as a lubricant if you need that, or as a moisturizer. So look out for things that don't have glycerin in them, particularly if you're prone to thrush. If you never get thrush and you have no issues with that, then, you know, any other brands such as Replens, there's Silk, there's a whole load of other different brands that we have.
The reason why I know they do it at the sexual health clinic is because I went after I found out my ex was cheating on me, obviously for sexual health reasons. And I have never had such a positive experience. Great. And I did say to them, like, I need to talk about this more, because I was right off the back of my breakup. Like, I'm talking 2 days after it had publicly been announced. And they spoke to me for so long. I think I was there for 2 hours. And that even at the end, they said, we think you need a mental health check right now. And I was like, I'm good. I have a therapist. I'm all right. But like, it was such an overall well-being check while also being a sexual health check, because I'd been cheated on while I was like, we obviously weren't using contraception because I was trying for a child. And then all the conversations around the hormones I'd been taking because of that. Like, it was so helpful. And I think there's so much shame around going to places like that actually, like, it was just so reassuring. It was such a positive experience that I was like, I really want to talk about this more, because I think, 1, people don't know it's free. 2, people don't know they exist, that there are clinics that are specifically for sexual health. And also just stay on top of those kind of checks as well. Oh,
it makes my heart sing that you had a good experience, because I think we need to share that. People are so vocal about sharing bad experiences, and I absolutely should always share bad experience as well, because we learn as healthcare professionals from what our patients are saying, and vice versa as well. But that's so lovely that they gave you that time and space.
Thank you so much for your time and space as well.
Thank you so much. We held our moment together. I don't know what that means. I'm using it at any given time now.
That was right timing, right? Okay. So what? Wait. Let me do this something. Also, I'm now sitting in that chair because I realised I couldn't see you. Because I was like, I have no clue what time we're on. Okay,
that's fine.
So we end every episode with something we're learning at the moment. It could be about any part of your life. Is there something you are working on, learning, something that you're unsure about?
I'm constantly learning. Do you know what? I have such a curious brain that I always am so inquisitive, and I love learning new things. So one of the things that I feel, to my detriment, I've never learned is how to sew. My mother is a seamstress, and I never learned how to knit or sew. So I'm trying to learn how to crochet at the moment, badly. And I sort of pick it up, and then I do a couple, and then I'm like, oh, get frustrated, and the kids distract me. But that is the one thing that I am learning. So crocheting, because so many cool people do it, like Tom Daley, and he looks so happy doing it.
Oh, I saw his clips at the Olympics. He's like happily, honestly, he seems so content.
He's such a I've met him. He's such a lovely guy. And he was like showing off his crochet jumper, and there was like a crochet jealousy happening inside me. I was like,
you know what? I believe
my mum does it, and it's a skill that I never learned from her.
I always got told, what am I talking about? Also, I forgot what mine actually is. 1 sec, let me just double check.
There you go. I name dropped Tom Daley. My only name drop that I've done.
You know what? If you can, you should. Wait, what was I talking about? One of the pieces of advice I always say is you should have a hobby you're shit at that you don't try to improve on just for the joy of it.
Yeah.
So the thing I'm learning right now was I actually woke up to a 5-minute voice note from one of my friends telling me how I inspired her to set boundaries, and she's now calling it Elmaning it. And she was like, I Elmaned it and set boundaries.
That could actually make the Oxford Dictionary.
But I woke up with a lot of shame when I listened to it because I had some rubbish boundaries last night. Basically, what I realized is when other people have bad boundaries around you, it can be really contagious. And because someone came to me with this sense of urgency last night at 10 p.m., I then passed on that sense of urgency. And the only reason she voice noted me this morning is because I'd sent her an urgent text last night at 10 p.m. because someone else had sent me an urgent text without the pause, stop, breathe. Is this important? Is this urgent? Just because someone else didn't have good boundaries doesn't mean you pass on the bad boundaries. So she had told me this whole thing of like how I'd inspired her. And it kind of gave me one of those moments of like, nope, your boundaries have slipped. Like I'm glad I inspired her. And also she inspired me because I was like, oh, you always, no matter how much you know about boundaries, you have to stay on it because like the way the world works and the pressure that's in this capitalist system is to always have weaker, more flexible boundaries that don't exist, frankly. Yeah. And so if you're not constantly working at that skill, but it was just like this kick up my ass this morning being like, no, last night was bad, back on the horse today, boundaries back. We're not doing this. We're not. And it's because she had taken a quote from my book where I said, your lack of planning doesn't constitute, your lack of planning on your end doesn't constitute a...
Your lack of planning.
Your lack of planning on your end doesn't constitute an emergency on my end. She had said it to me and I literally went...
That is a quote I think we definitely need on a t-shirt.
We need it, but also I forgot it last night and I acted like it was an emergency and it was not an emergency. And it was just, I want to share that because it's important to say, even when you are the queen of boundaries or like the expert in it, you forget too and you can slip, but it doesn't mean you slip. You catch yourself, you go back on the horse, you try again. And that is the thing that I am going into the rest of this week, prioritizing boundaries and just... don't let other people's lack of boundaries be contagious.
Oh, so love that. I am the worst with boundaries. I have no concept of boundaries sometimes. Yet.
You are not good at boundaries yet.
I'm constantly getting better. The thing is that I come from a community and a culture where if you close the door on someone, my worry is always that they won't return. And it's because my father would always open the door to anyone, night or day, if they needed something. Because I always feel that somebody always only messages you and talks to you or asks you. And I suppose that's because of my role as a doctor. It's a vocational job. Mm. And so you just want to give that person time and space. The thing that I've learned that is really good, and actually you taught me this, is to say, I heard you and I'm listening to you, but right now, can I pick this up with you later? Yeah. And I think that's been really helpful.
Or
like not closing the door, but saying, I'm just so busy right now.
Yeah.
Because sometimes that can really put someone off telling you anything because they're just like, oh, she's too busy for me.
The question I ask is, do you have someone else you can talk to about this right now? Because it's not saying like, no, if you really need me, I'll be there. But if there's someone else who can do this right now, I really need less on my plate.
Yeah. And the other thing that I'm learning is I've suddenly weirdly started exploring Korean food. And I know that's like so left field for me.
We need to go for Korean barbecue.
We do. Oh my God. I had such a massive hankering for Kung Pao sweet and sour Korean chicken.
That is such a weird
and very specific.
No, but also that's an amalgamation of
two different things. Like, I know.
Cuisines.
But also, but I saw it on I think it's because I think, actually I was in Dubai. I'm going to just drop that in. And they just had the best, I went to this place and they just had the best Korean halal food. And then suddenly I was like, there's a Korean food which I've never tasted before. So now I want to have like Korean popcorn chicken.
I'll take you to the best Korean places.
You have to take me.
Yes.
So this is me just asking Michelle out on a date because I might as well use that
opportunity. I'm always up for a date with you.
And food.
Thank you so much for coming. I really appreciate you taking the time out of your busy schedule. And I love you so much.
Oh, thank you. Right back at you.
Thank you so much for listening. And if you enjoyed this episode, feel free to leave us a review. A 5-star rating would be much appreciated. And we'll be back next Tuesday for a brand new episode.